Cancer is one of a lot of diseases you can get. If I had to choose rheumatism or a first stage cancer, I would take this first stage cancer, because that can be treated more easily with unconventional methods. We have to avoid that cancer is like a death sentence and you have to say goodbye to your children and grandchildren, and it's not. It's just a disease. It's sometimes very dangerous, but when you get it early, and that is what I always say, get it early. It is a disease like any other diseases, and you can heal that. Every year we will sure have more preventative panel in Metavectum, which is also cheaper, because some people just cannot afford expensive tests, and that is so sad for me. Everybody should have the same chance to do that. We are working on that we make the test cheaper, but at the moment it's so complicated, everything. We have already the start with this EDIM test. It's a very good idea. The problems are the method, because you need some immune cells, the macrophages, which eat a bit of the tumor, and then you can detect it in the blood. I explain it to my patients that are like little rats. They are creeping around in the body, and when they see a tumor, they bite it and eat it. And we take the rats and open it and see if there's a tumor inside. That is a simple explanation. So we can look for your rats and see if they have found a tumor. But the method is limited because you need a certain amount of this macrophage, especially in sick people. They don't have enough. For example, if you have a little wound inside or a hematoma you don't know, then the test goes positive too. And so what we are doing in Metavectum in the future, we check also the gene expression of this TKTL1 and APO10, and then you have it. We have to discuss everything with the patient and explain to him. You have to be open for a patient's sorrows, and you have to find the trust of the patient. And then you can develop a therapy together with the patient. You can explain to him, what if we give you killer cells from another person? Why are we doing that? Yeah, because your own killer cells are not enough and not good enough. Or why should I not eat sugar? Then we can explain to him, okay, we found signs in your blood that your tumor is specialized for consuming sugar. And if you eat sugar, you feed the tumor more than yourself. Then when it comes to Metavectum test, for example, we can characterize the tumor and select the right therapy for the patient. So you have to explain that to the patients. That is most important. That is not your faith. Once you are diagnosed with cancer, you have a shit of a disease, but that is not the end. You can treat it very well and in an individualized form.